Hello, good morning. Ah, sa atong live, please comment kung okay ba ang audio, madungog ba ninyo ang audio?
wild animals, such as bats, beavers, coyotes, foxes, monkeys,
Ragdoll, ragdoll. I've got a fever, I'm kinda scared. You don't care. You make me furious, you make me drool. I might have done rabies, but babe, I'm not a fool. Encephalitis, you make me crazy. My mouth is foaming, my thoughts are hazy. I'm hydrophobic and look right in my eyes. Corneal scrape is one diagnostic sign. And I was like rabies, 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 oh, like rabies, 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 oh, like rabies, 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 oh. I hope you vaccinate me in time, time. Rabies, 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 oh, like rabies, 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 oh, like rabies, 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 oh. I hope you vaccinate me in time, time. G proteins and ACH receptor, L polymerase PCR detector, negri bodies in hippocampus, seen in a biopsy during an autopsy. And I see a raccoon, I wanna pet it. It wants to lick me, think it likes me, should I let it? And I'm saying ow, 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 cause it bit my hand, and now I'm pretty sure that I have rabies, 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 oh, like rabies, 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 oh, like rabies, 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 oh. I hope you vaccinate me in time, time. Rabies, 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 oh, like rabies, 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 oh, like rabies, 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 oh. I hope you vaccinate me in time, time. Bullet! When I was 13, I had my first bite. They prophylacted me right there, half at the nearest muscle, other half right at the site. HCV vaccine, RIG globulin, mostly from mammal bites and transplanted organs. Or I might inhale particles from bad pee while spelunking, prodromal paresthesis, accompanied by some flu-like symptoms. I hope I don't get a seizure, cause that means it's too late. Already in my nervous system, and the highest death rate is from rabies, 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 oh, like rabies, 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 oh, like rabies, 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 oh. I hope you vaccinate me in time, time. Rabies, 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 oh, like rabies, 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 oh, like rabies, 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 oh. I hope you vaccinate me in time. Now I'm all gone. Yeah, 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 yeah. Now I'm all gone. Yeah, 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 yeah. Now I'm all gone. Yeah, 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 yeah. Now I'm all gone, gone. It's Jada Lungs.
Araw-araw natin silang nakikita. Maaaring habang naglalakad tayo sa labas o nakakasama natin sa tahanan bilang bahagi ng ating pamilya. Pero naisip mo na ba kung ligtas tayo sa piling nila? Mayroong nakamamatay na sakit na sa kanila nagmumula. Rabies. Ang rabies ay isang nakamamatay na sakit na sanhi ng virus. Dito lamang sa Pilipinas, nasa 250 Pilipino ang namamatay sa sakit na ito taon-taon. 40% pa ay kabataang nasa 14 na taon at mas bata pa. Ang rabies ay maaari nating makuha mula sa laway galing sa kagat ng isang hayop na mayroong sakit na ito. Ito ay kumakalat paakyat sa utak kapag hindi ka agad naagapan. Nakamamatay at walang lunas ang rabies na nakaakyat na sa utak. Ilan sa simptomas nito ay ang mga sumusunod. Lagnat, pagkatakot sa hangin, liwanag at tubig. Matinding paglalaway, sakit sa ulo, at hirap sa paghinga. Tandaan, karamihan sa mga taong namamatay sa rabies ay dahil sa kagat ng aso. Paano mo nga ba malalaman kung may sakit na rabies ang isang aso? Pagkakagat nito ng kung ano-anong bagay, matinding paglalaway, nagkakaroon ng pagbabago sa ugali, nagiging agresibo yung dating mabait na aso o nagiging tahimik yung dating masiglang aso. Takot sa tubig at liwanag. Kapag nakagat ng isang aso, gawin ang sumusunod. Kaagad hugasan ang kagat para maalis ang laway ng aso. Sabunin ito ng maigi sa malinis at dumadaloy na tubig sa loob ng 15 minuto. Effect ng alcohol o iodine. Kumonsulta agad sa doktor kung sa pinaka-12 by treatment.
Keep safe, and God bless. Keep safe and God bless.
Thank you. Need ko ano ko ano siya, mag-share ko screen, di ko
to our webinar on anti-rabies awareness and advocacy, brought to you by the Department of Education School Health Section. So this morning we're going to have a program on this advocacy, and before we formally start with the program, we would like to remind everyone to please register to the link that was provided earlier so that your attendance will be counted. So this morning we're going to start the program with a preliminary for the national anthem and the to be followed by the opening prayer, which is aired via a video and audio. So I would like to request everyone to please pause for a while for our national anthem and our opening prayer. Start the program. We would like to remind everyone, please register to the link that was provided earlier so that your attendance will be counted. So this morning we're going to start the program with a preliminary for the national anthem and the to be followed by the opening prayer, which is aired via a video and audio. So I would like to request everyone to please pause for a while for our national anthem and our opening prayer. Start the program. I would like to remind everyone, please register to the link that was provided earlier so that your attendance will be counted. So this morning, we're going to start the program with a preliminary for the national anthem and to be followed by the opening prayer, which is aired via a video and audio. So I would like to request everyone to please pause for a while for our national anthem and our opening prayer. Start the program. I would like to remind everyone, please register to the link that was provided earlier so that your attendance will be counted. So this morning, we're going to start the program with a preliminary for the national anthem and to be followed by the opening prayer, which is aired via a video and audio. So I would like to request everyone to to the link that was provided earlier so that your attendance will be counted. So this morning, we're going to start the program with a Okay, so I hope everyone is already seated. And at this juncture, we are going to formally start our program with an opening remarks to be delivered by our Assistant Schools Division Superintendent, Madam Rosemary T. Masisar.
Okay, a happy Wednesday morning to all of us. So, I'm sorry, I just logged in because I have a webinar to attend to today, starting today until Wednesday. But anyway, so once again, I would like to greet all of you a happy Wednesday, most especially to our Schools Division Superintendent, Dr. Edelberto L. Opinaria, and of course, our SGOD Chief, Dr. Maria Carmela T. Ablin, our CID Chief, Dr. Maria Eva Saire Edon Saire, and then of course, all the section heads, especially our um, school and nutrition section head, Dr. Melvin and Dr. Celia, and the rest of the nurses, and of course our school heads and teachers who are tuned in to this webinar on anti-rabies awareness and advocacy. So I know that we are all busy, but we need to take some time to attend to this seminar because this is equally important, just like other webinars that we are conducting, because um, this anti-rabies awareness and advocacy should be promoted by our people in the field so that our children, our community people will be safe because they are already aware that for them to be spared from worry about being bitten by their dogs. They need to be aware of this, and that they must, on their part, if they have dogs, they must see to it that their dogs must be injected with anti-rabies so that just in case their dog uh, will bite somebody, so at least they will not worry, and those that persons or the person that was bitten by their dog will not be that uh, afraid already because the dog that bit them was injected with an anti-rabies. And then, so it's very important that we listen to the webinar today so that our people in the field will be able to also campaign in their respective communities about this, and then that they will not take these things for granted because it is for their own safety, protection. In other words, it is there for their own good. So I hope that our participants to this webinar on anti-rabies awareness and advocacy will really stay until the end of this webinar and listen very well to our speakers, because I know they will be able to give you so much inputs that will be helpful to you in your campaign to end this, to promote anti-rabies awareness and advocacy. So again, I welcome you all to this webinar on anti-rabies awareness and advocacy. And but before I end, I would like to thank and congratulate at the same time our school and health and nutrition section for coming up with this webinar. And I know that this will be a successful one because you prepared for this very well. And I just hope the people in the field are receptive to this invitation on the webinar and make use of whatever they will learn from this webinar. So once again, thank you and God bless us all. Happy Wednesday.
Okay, thank you, Ma'am Rose, for that very heartwarming words. Now to proceed, let us give time for the statement of purpose to the Chief of the School's Governance Operations Division, Ma'am Maria Carmila P. Ablin.
For the information and guidance of all concerned, the Department of Education issues the policy and guidelines on a comprehensive anti-rabies for the effective implementation of a cohesive and comprehensive anti-rabies control program to promote a healthy environment in and around schools and learning centers. My respect to our Schools Division Superintendent, Dr. Edelberto Oplinaria, our Assistant Schools Division Superintendent, Dr. Rosemary Masisar, the CID Chief, Maria Eva Idon, our invited guests, the CID personnel in attendance, STOD personnel in attendance, the Health and Nutrition Section. Good morning. So the Schools Division Office of Lanao del Norte, through the School Health and Nutrition Section of School Governance and Operations Division, initiated this training for the following purpose. Aims to raise awareness on the nature of the disease, provide idea on first aid management of animal bite and on how to prevent from getting rabies infection. Strengthen the National Rabies Education Program through school health teaching as mandated by the Department of Education through the implementation of RA number 9482 or the Anti-Rabies Act of 2007. So this webinar is anchored on RA number 9482, which is the Anti-Rabies Act of 2007 that supports in controlling and eliminating human and animal rabies, including the prescribing penalties for violation and appropriation of funds for the implementation of the program. So the Department of Education is one of the government agencies defined in Section 6 of this Act to implement this Anti-Rabies Act of 2007. That is why we are having this training today. So under Section 6C of this Act, the Department of Education is expected to strengthen rabies education program through school health teaching and at the same time in curriculum, assist in dog mass immunization campaigns in the community, encourage collaborative activities with the DA, DOH, DILG, DNR, NGOs, POs, and other concerned sectors, integrate proper information and education on responsible pet ownership in the relevant subjects in the elementary and high school levels. So we can, at the end of this statement, at the end of this seminar, we can achieve a success in this endeavor when we pour our hearts and energies in the realization of this program. Have a good day. Kukumka. Good morning once again.
Thank you very much, Ma'am Ablin, and thank you for setting us and preparing us mentally and physically and opening our minds for today's activity. Now to proceed, let us give time for the message by our Schools Division Superintendent, Sir Edilberto L. Plenaria. Okay, to proceed, let us now start formally our lecture. But program coordinator, Patri Raipa di Dumato. Tuloy-tuloy na.
Good morning, everyone. Before I introduce our speaker for the morning, may I request everyone to please turn all your video so that I can see your face for the documentation. And there is a contest that you can wear your best hat so that I can see your best animal hat. Picture na po, ganun. Gallery. Okay.
Pat, animal face na lang, Pat. O, ano may hat?
Well, lagi chip. Wala mga picture na.
Madam Michael ko, nag-animal face ka.
Oh, animal face na lang, Pat.
Animal face na si Mamay.
Meow, meow. Pag-picture. Okay, smile. 1, 2, 3. Wala na. I'm going to introduce our first speaker for this day. He is graduated of medicine in 2011 at MSU College of Medicine and was awarded Best in Community Medicine, had postgraduate internships at DOH Philippine Centers for Specialized Healthcare from 2011 to 2012, passed the Physician Licensure Examination exam in 2021, former doctors to the various assigned in Socorro, Surigao, Lanao del Norte from 2012 to 2014, garnered Masters in Public Management, major in Health Systems at Development Academy of the Philippines, Tagaytay, and was awarded Performance Excellence Award and Best in Action Plan Project Paper. Trained in Family and Community Medicine from 2015 to 2020 at Agusan Practice-Based Residency Training Program, and awarded 2018 Best Resident Doctor in and 2018 National Winner for Community-Oriented Primary Care Project regarding his community-based drug rehabilitation program. Became Diplomate in Family of Medicine March 2021, ranked 4th in the National Certifying Written and Oral Exam. Currently, the OIC Chief of Hospital at Mainit Medicare Community Hospital and Community Physician in Hayangabon, Claver, Surigao, Lanao del Norte, and a mentor in the Agusan, Lanao del Norte, practice-based residency training program in family and community medicine, an advocate of preventive health and mental health. May I present Dr. Chrismar Lumasag Mocoro. Doc, good morning, Doc.
Is the audio good? Madunggan
Yes,
ako?
yes, Doc.
Okay.
Yes, Doc.
So I will be sharing my slide. Nara, okay na?
Yes, Doc.
Okay, so before I start, who among you here are dog owners? Pila ka daghan mo? Can you raise, how do you raise your hands here? Kinsa may mga dog owners diri? Okay. So today I'll be discussing to you about the management of animal bites. So we should prevent rabies by management of these animal bites. It's very important. So this is the current global situation of rabies. It remains endemic in 150 plus countries globally, causing approximately 59,000 human deaths, and that is about one death every 9 minutes. Most of the cases are in Asia and Africa regions, 95% cases of that, and mostly affected are children under 15 years old. The 99% of rabies is caused by dog bites. Okay, as you can see now, in the Philippines, it's in the orange. So 90 to 400 ang affected ato sa ato in our country. So this is the burden of rabies. The animal rabies burden is 8.6 billion US dollar and 490 US dollars spent on human rabies vaccine, 4.7 billion US dollar lost due to premature death, and 9 million US dollars spent on dog rabies vaccine. So there is a plan for 0 by 30. That means that there is to end human death from dog-mediated rabies by 2030. Of course, this is still a collaboration of different stakeholders. The first objective is to effectively use vaccines, medicines, tools, and technologies to reduce human rabies risk. That is through improvement of awareness and education. I thank the DepEd in your region for having this initiative to increase access to healthcare, medicines, and vaccines, and to increase dog vaccination. The second objective is to generate, innovate, and measure impact. That is to provide guidance and data through effective policies, guidance, and governance, and to ensure that reliable data to enable effective decision making. So the decision makers for this are the LGU and the DOH. For the objective 3, to sustain commitment and resources, that is to harness multi-stakeholder engagement. So this is not just the work of the DOH or the agriculture, but also the DepEd, the LGU, of course, all members of the community. That is to demonstrate the impact of activities completed under the United Against Rabies collaboration. So for the animal bite status from 2007 to 2018, you can see there is increasing trend of animal bites. There was a abrupt decrease from 2016 to 2018. There is still no data for 2020, 2021, but I am pretty sure that there are still lots of animal bites, especially that during the pandemic, there is increase in the ownership of dogs. For the human rabies from 2007 to 2018, so more or less, the range is from 250s. No? In the recent data, there are 276 human rabies cases in the Philippines. So that's a large number. In terms of regions with most number of animal bites, Region 10 ranked 8 with 67,017 animal bites. Region 4A is the number one for this. But in 2018, nag-decrease ang sa Region 10. But an NCR nag-increase siya on 2018. In terms of human rabies, for Region 10 in 2017, there are 14 cases of human rabies. Region 3 ang pinakadaghan. In 2018, the Region 10 has 11 cases of human rabies. There is decrease trend. So there is somehow initiative from this region. So for the animal rabies cases in the region, so this is spent to check for the presence of rabies. So for region 10, more or less, there are 124 positive, negative animal rabies cases and 47 positive. Is there a large number of positive animal rabies cases? So there is a need to increase really the immunization for dogs. So you can actually have declaration of rabies-free zones. When I was still a Dr. Sudamario in Socorro, 2014, we were declared as a rabies-free zones, and this is due to the different multi stakeholders collaboration from the LGU, from the DOH, from the agriculture, and the rest of the members of the community. So there is a certain requirements for this, like no rabies case for more than 20 years. There is a certain percentage of human vaccinated dogs and certain percentage of dog bites that were managed through vaccination. And of course, how the car the dogs are there is ordinances for taking care of the dog ownership. So let's start with what is rabies. Okay, rabies is a dangerous disease of animal that is transmissible to human through the bites of infected animals, particularly dogs. But it can also be transmitted by other animals, but it's mostly dogs. Remember that rabies is 100% preventable, but 100% fatal. It is a virus called Lissa genus virus from the family of Rhabdoviridae viruses. Okay, so we really need to manage animal bite to prevent rabies and prevent human rabies. So how is this transmitted? It is transmitted through contact with the virus-laden saliva of a rabid animal. This could be in the form of bites of rabid dogs, or when gets in rabid dog bites licks an open wound, or when the virus-laden saliva gets in contact with cuts in the skin. So there are several ways of transmission na makasulod siya sa imong body. What are the signs and symptoms of rabies? So the most important history for this, if the patient has been bitten by a dog, and after bitten by the dog, the patient exhibited these symptoms: headache, fever, paralysis, inability to swallow, hydrophobia, and aerophobia because of the spasm of the muscles controlling your esophagus and your lungs. There are chills, severe sweating, restlessness, coma, and death. So once you exhibit signs and symptoms of rabies, then definitely you will really be dying. 100%. There is still no case of a patient infected with rabies who survive. So prevention is a must. So the incubation period is the time when after bitten by a dog, there is already a exhibiting of symptoms. So the typical incubation period is as 3 to 8 weeks. So it can be as little as 9 days or as long as several years in some rare cases. It depends on several factors that includes location of the entry wound, severity of the wound, animal's immune system. But the general rule is that the farther the wound is from the brain, the longer the incubation period will be. So there is a difference in the management of animal bites if it's you're bitten in the head area versus if you're bitten in your leg area. So what to do when bitten by the animals? So the first aid for this is to wash the wound immediately with soap and running water for 10 minutes. You apply betadine. Do not apply ointment because it could cause growth of bacteria. And do not cover the wound, just betadine. After that, you consult immediately to nearest health facility and observe the dog for 14 to 15 days. You should not kill the dog who bite the patient. Okay, so this is you do not put garlic. I remember when I was a kid, my dog bite was clean, but garlic was put there. So it should not be done because it is a causing bacterial growth. And do not perform tandok because you're dealing with a virus here, and this is dangerous. It could, aside from uh, contributing to the growth of bacteria, the one performing the tandok could also have the virus. Okay, so this is dangerous. So what are the general guidelines for animal bite? So this is a management of animal bite cases, including provision of human rabies vaccine, is a joint responsibility of DOH and LGU. There is advocacy through information, dissemination, and training of health workers that shall be conducted at all levels, and collaboration and coordination among government agencies, non-government, and private organizations to ensure successful implementation shall be strengthened. So the specific guidelines is to initiate post-exposure prophylaxis or PEP, and it should not be delayed for any reason regardless of interval between the exposure and consultation. as it increases the risk of rabies and it is associated with treatment failure. So once bitten by a dog, do not delay the vaccination for rabies. There should be immediate washing of the bite wound and the exposed area with soap and running water and application of an antiseptic solution reduces the risk of rabies transmission. But that point, okay, there are no absolute contraindications to rabies PEP. Patients allergic to specific vaccine, RIG, or its components shall be given the alternative vaccine or RIG. So we have equine RIG and human RIG. Human RIG has no allergic contraindication because it comes from a human. So these rabies can also be given to infants. It can be given to pregnant women and the elderly. There is no absolute contraindication for this. So let's proceed with the category of exposure. Your management will based on the exposure of the dog bite. So category 1, if it's just feeding or touching the animal, licking of intact skin, exposure to patient with signs and symptoms of rabies by sharing of eating and drinking utensils and casual contact, that's talking to, visiting and feeding suspected rabies cases, and routine delivery of healthcare to patient with signs and symptoms of rabies. So what are you gonna do? You just wash exposed skin immediately with soap and water. You don't have to give vaccine or rabies immunoglobulin. But if you're a high risk person, we will be discussing who are the high risk for this. Pre-exposure prophylaxis may be considered. So we have category 2, nibbling or biting of uncovered skin with or without bruising or hematoma, the presence of minor superficial scratches, abrasions without bleeding, including those induced to bleed kanang ipadugo, and all category 2 exposure on the head and neck area. We know that if you are bitten in the head and the neck area, the incubation period is higher because it's closer to your brain, or lower rather, and it should be managed as category 3. So for category 2 exposure, we just wash with wound and soap. Do not forget this management. You start the vaccine immediately and you complete the vaccination regimen until day 7, regardless of the status of the biting animal, whether the animal was alive or manifest with uh, animal rabies symptoms. But you do not give RIG for this or rabies immunoglobulin. So this is a sample of a category 2 exposure. For the category 3 exposure, there is transdermal bites. Okay, kanang lalom na kayo nga paa that cause punctured wounds, presence of lacerations, avulsions or scratches, abrasions with spontaneous bleeding. So there is abrasion but there is spontaneous bleeding, wala nagipadugo. As category 3, if you have a broken skin or your leak in the mucous membrane, so if you have a mouth-to-mouth, dogs loves to lick and sometimes they lick your mouth. So that could be considered category 3 if you exchange saliva. Okay? And exposure to rabies patients through bites, contamination of mucous membrane, oral, nasal mucosa, genital, anal mucous membrane, or open skin lesion with body fluids through splattering and mouth-to-mouth resuscitation. The presence of unprotected handling of infected carcasses, ingestion of raw infected meat, exposure to bats, and all category 2 exposures on head and neck. So that is considered category 3. Most of our patients, as I said, are children. So these are examples of children bitten in the face. So very, very severe cases of animal bite. So what is the management for category 3 management? You wash with wound. The, you wash the wound with soap and water. You start the vaccine and RIG immediately, and you complete vaccination regimen until day 7, regardless of the status of the biting animal. Reminders, Dog owners have the responsibility to keep their dogs for observation under the Rabies Act of 2007, with penalties to violators provided for by the law. So we have to know who is the dog owner of this bitten animal, and the animal should be kept for observation. And only the intradermal regimen will be used in the administration of vaccine in all government facilities, except for conditions that require IM administration. So only those with who are immunocompromised can be given IM administration, but the rest you can be ID. So let's proceed with active immunization. So we have active and passive immunization in management of rabies. So for active immunization, this is administered to induce antibody and T cell production to neutralize rabies virus. Usually, it induces active immune response in 7 to 10 days after the vaccination, and protection may persist for years provided that primary immunization is completed. So you have to complete the scheduled immunization for vaccine for you to be protected for years. Okay, so there are two types of rabies vaccines: purified varicella rabies vaccine and purified chikungunya cell vaccine. So these are some of the samples of vaccines available. The the brand are Verorab, Avirab, Vaxirab. We also have Rabipur. Okay, so let's proceed with the passive immunization. So RIG, or rabies immunoglobulin. It shall be given in combination with rabies vaccine. It's not a standalone. And this is to provide immediate availability of neutralizing antibodies at the site of exposure. If you can recall, the active immunization will be effective after 7 to 10 days after being injected. But for IGs, they will be available immediately to neutralize the rabies antibodies, but it will be gone after 21 days. The half-life of RIGs is only 21 days. So we have two types of RIG. We have the human rabies immunoglobulin given at a lower dose of 20 international units per kilogram. So this has no allergic consideration. For the equine rabies immunoglobulin given at 40 international units per kilogram. So how do we administer RIG? This is for the nurses. You have to remember this because you're the one administering this RIG. So the total computed RIG shall be infiltrated around and into the wound as much as anatomically feasible. So if the bite is in the face, you infiltrate the RIG in the face. If it's in your hand, then in the hand. By using a 23 or 24 needle, 1 inch length shall be used for infiltration, and you have to avoid use of multiple needles, just one. And the art, you perform the art of infiltration and the art of injecting. The skin testing for earache is highly recommended. So to prevent uh, anaphylaxis or allergies. If finger or toe needs to be infiltrated, care shall be taken care to ensure that blood circulation is not impaired, and RIG shall not exceed the computed dose as it may reduce efficacy. So really have to compute for the RIG, and it shall always be given in combination with rabies vaccine. Now, there are cases that the RIG is not available or the vaccine is not available. In case RIG is not available on day 0, it may still be given until 7 days after first dose of the vaccine. If RIG and vaccine cannot be given on the same day, a vaccine shall be given before RIG. It should not be the RIG first given and then the vaccine. Why? Because it will compromise the neutralizing bodies that are forming in your body. And RIG shall be given only once during the same course of PEP. So only once, while the vaccine, there is schedule for this. And all bite centers shall be equipped to handle allergic reactions should they occur. So dapat available ang mga medications just in case allergic reactions uh, will happen. And patients shall be observed for at least 1 hour after injection of ERIG for immediate allergic reactions. So how do we manage adverse reaction for passive immunization? So if there is anaphylaxis as presented with a difficulty breathing and hypotension and presence of hives in your body, you give 0.1% of epinephrine IM. For adults, we give 0.5 ml. For children, 0.01 ml per kilogram. And to repeat the dose every 10 to 20 minutes for 3 doses. And we can give steroids after epinephrine. Of course, uh, with the presence of a physician for this. For hypersensitivity reaction, we give antihistamine. If no relief after 48 hours, we can give short course of combined oral antihistamine plus steroid. If it worsens, we hospitalize the patient and we can give IV steroid in addition to antihistamine. News alert, global vaccine shortage of World Health Organization pre-qualified vaccine na shortage as Saberurab and Rabipur. And in the market, the following vaccines are available: Abairab, Vaxirab, and Enspida. For the RIG, we have Equirab and Verirab, but needs to be purchased privately. So there is some shortage of vaccines worldwide. But we would not be consuming more vaccines. Responsible pet ownership is the key. Now let's proceed with the treatment for the post-exposure prophylaxis of once you're bitten by the dog. So of course you will be given vaccines and then we will be treating the local wound. So wounds shall be immediately and vigorously washed, flushed with soap and detergent and a water preferably for 10 minutes. We apply alcohol, povidone iodine or betadine or any antiseptic, and we do not suture the wounds at all times. Dili on, no? But wounds may be coaptated using sterile adhesive strips, and any ointment, cream, or wound dressing shall not be applied, and anti-tetanus immunization may be given if indicated. It depends if of the history of the patients given by anti-tetanus immunization. So for tetanus prophylaxis, it is based on the vaccination history. If the patient does not know his or her vaccination history or less than 3 doses given, for all animal bites, we should give the tetanus toxoid and the anti-tetanus serum or TIG. If these 3 or more doses given for vaccinated TT previously, we do not give the toxoid and the ATS. Yes, if more than 5 years since last dose. So the number of years and previous history of tetanus toxoid injection is also important for this. So routine wound management, antimicrobial shall be recommended for the following: all frankly infected wounds, all category 3 cat bites. So there is more infection for cat bites because they have more bacteria in their saliva. And all other category 3 bites that are either deep, penetrating, multiple, extensive, or located on hand, face, genital area. So these are the recommended antimicrobials. We can give amoxicillin, clavulanic, cloxacillin, ceftriaxone, or amoxicillin if there's no obvious signs of infection. So this is the milder antimicrobial. If the patient is allergic to penicillin, you can give doxycycline for adults and erythromycin for children. Now, so this is the vaccination. How do we give? How do we store? So the general principle for post-exposure prophylaxis for vaccination is to store at 2 to 8 degrees Celsius in a refrigerator, not in the freezer. Okay. Once reconstituted, vaccine shall be kept in the ref and used within 8 hours. Administration area: injection shall be given on the deltoid area of each arm in adults or in the anterolateral aspect of thigh in infants. Vaccine shall never be injected in the gluteal area because absorption is unpredictable. So the vaccination for scheduling: So one dose for intradermal or ID administration is equivalent to 0.1 ml of PVRV or PECV. And one dose shall be given on each deltoid on days 0, 3, 7, 28. So day 0, that's the first day you'll be given the vaccine. One intradermal dose shall have at least zero point 0.5 international units of vaccine potency, and when you inject intradermally, it shall produce a minimum of 3 millimeter wheal. If it's less than 3 millimeter, then it might not be effective. And 1 ml syringe with cage 27 needle shall be used for ID injection. Okay, and should vaccine dose be delayed for any reason, the PEP regimen should be continued. Still continue. So this is the two-site intradermal. So two-site, left and the right deltoid. On day 0, 3, 7, and 28, you just give 0.1 ml on the left deltoid and 0.1 ml in the right deltoid for adults, or antilateral for thigh in infants. But there is an updated Institute Pasteur de Cambodge IPC intradermal regimen. So this is much simpler. Day 0, 3, and 7 only. 0.1 on the left and right deltoids or anterolateral thighs in infants. So we can follow this day 0, 3, 7. So we will be giving the patients only 3 shots of anti-rabies vaccine. So these are some special conditions. Pregnancy and infancy are again not contraindicated, and immunocompromised individuals shall be given vaccine using standard IM regimen. So those patients with history of HIV shall be given IM regimen, or those with cancers who are immunocompromised. Exposed persons who present for evaluation weeks or months after the bite. Say for example, you have a patient bitten now, and after a month the patient consulted for vaccination. The bite shall be treated as if exposure has occurred recently. Okay. However, if the biting animal has remained healthy and alive with no signs of rabies until 14 days after the bite, no treatment shall be needed. Okay, so this is very important in the history. How's the animal that bites you? Of course, the animal should be available for observation. If you are bitten by a rodent, guinea pig, or a rabbit, it shall not require rabies post-exposure prophylaxis. But bites by domestic animals like dogs and cats, livestock, cows, pigs, horses, goats, etc., as well as wild animals, bats, monkeys, etc., shall require PEP or vaccination. So there are those who were bitten previously, so they were given anti-rabies vaccine previously, and then they are bitten again. So what do we do? How do we manage this? Because this is some common questions asked to me. So it depends on the history of anti-vaccine given. So if patient receive complete, that's PrEP, uh, pre-exposure prophylaxis, day 0 and 7, or receive day 0 and 3 doses of PEP, ID on IM, you don't need RIG, and you have to determine whether high or low risk bite. If the patient complete PrEP day 0 and 7, or patient receive at least day 0 and 3 dose of PEP, ID, and IM, and the patient is immunocompromised or bitten by a bat, you should give our IG again and give full course of PEP. If the patient did not complete PrEP or patient received only 1 dose, you should give RIG again and give full course of PEP. Okay, so it depends on the history of the patient. So these are the high risk and the low risk exposures. So if the high risk exposure is any of the following: biting animal cannot be observed, or the biting animal dies or is sick. Site of the body is in highly innervated parts of the body like the neck, the head, the genital area and the hands and the toes. So that's high risk again. Multiple deep bites, that's high risk. Patient coming from GD areas or geographically isolated and distant area. Infrequent transportation to and from the animal bite center. The immediate we should give immediately booster injections to the patient. So the booster dose is 0.1 ml ID at 4 sites on day 0. Okay, so 2.1 in the left, 2.1 ml ID on the side. So 4 doses or 0.1 ml at one site on days 0 and 3 only. Okay, for low risk exposure, so last dose of vaccine was within the previous 3 months. 3 months, and the biting animal is healthy, owned, kept on a leash, or can be confined and is available for observation, and any of one of the following. The biting animal is the same animal that bit the patient previously, or biting animal is previously immunized, or bite is on the extremities or trunk, not on the head, not on the neck or genital area. You observe the biting animal for 14 days, and if the animal remains healthy, then we can withhold booster dose. And there are also management of rabies exposure from bite of animals vaccinated against rabies. So, what if the animal that bit you is vaccinated against rabies? So, it depends on the exposure. If the bite is a category 1, we don't need PEP. For category 2 exposure, we know obvious human rabies vaccine shall be provided if all conditions are met. First, the dog or the cat is healthy and available for observation for 14 days. The dog or the cat vaccinated against rabies for the past 2 years. And dog shall be at least 1 year old and 6 months with updated vaccination for the last 2 years. And the last vaccination shall be within 12 months. So if biting animal starts to show signs of rabies, we give vaccine or RG immediately. If remains healthy, we don't need to administer vaccine against rabies. If it's a category 3 exposure, as previously mentioned, in the bitten in the head and the neck, it's deep, it produces blood, and vaccine and RG is required. So we have pre-exposure prophylaxis. So this is needed for passive immunization to be eliminated, and PEP vaccine regimen is reduced from 5 to 2 doses, and protection against exposure to rabies is possible, and the cost of vaccination is reduced. So even before you are not bitten by the animal, you're already given pre-exposure prophylaxis vaccine. So the target population for this is personnel in rabies on diagnostic lab, animal handlers, veterinarians and vet students, animal handlers, healthcare workers involved in rabies patient, and individuals directly involved in rabies control, field workers, there are lots of dogs in the field, and for children 2 to 10 years old, because most of the time they're the one playing with the dogs, and they might have done something to provoke the dog, and they are bitten. So this is also recommended for children 2 to 10 years old. So this is how we give the pre-exposure prophylaxis schedule. For intradermal, just give 2 doses, zero point 0.1 ml on day 0 and zero point 0.1 ml on day 7 and zero point 0.1 ml on day 21 and 28. Okay, so these are the routine booster schedule for individuals given pre-exposure prophylaxis. If it's a high-risk exposure, those health workers handling rabies cases, workers in rabies laboratories, vets, vet students, and animal handlers like dog trainers, workers in the pet shops and zoos, etc. We can give booster dose 1 year after primary immunization, one site, zero point 0.1 dose, or one site of IM. And thereafter, one booster if IV titers fall. So there is need to check for the titers for this. Or in the absence of serologic testing, one booster dose every 5 years. For the general population that's low risk, no routine booster after primary immunization. So we can just give for children 2 to 10 years old, we just can give primary immunization. So these are my references: DOH Administrative Order number 2018-13, the revised guidelines on the management of rabies exposure. It was released on April 16, 2018. And DOH Caraga PowerPoint presentation on program status of the National Rabies Prevention and Control Program as of January 26, 2021. So I have two dogs, a toy poodle. Her name is Esther, and Kindo. So during the pandemic, it's really stressful, especially being a frontliner, especially being a doctor. There are lots of concern regarding COVID, and it really helped me to have a dog for emotional support. Especially my family is far; they are in Ligan, and I'm here in Surigao del Norte. So we don't fear dogs. We just need to be responsible owners of dogs, because once you are responsible and you take care of them properly, you know how to raise them well. They will not bite when not provoked, and of course they can give emotional support to you. And this is all about responsible pet ownership. Thank you for your time. I'm done with the presentation. Thank you.
Thank you, Doc. Thank you very much for the very nice lecture on rabies. And may I now ask all the participants if there are any questions regarding the lecture of Dr. Mokoro. You may raise your hands or write on the chat box if there is any questions or verifications related to this lecture.
Hello.
Hello, Doc. Good morning po.
Yes, ma'am. Good morning.
Meron kasi, you mentioned, parang nadinig ko kanina yung about sa rabbit, pero hindi ko siya na-catch up agad. Meron kasi akong rabbit, and then,
Yes.
na equivalent ng, nila, rabies nila.
Okay, regarding that, not all animal bites shall be given rabies vaccine, because others are they don't carry rabies. Okay, so rodents, guinea pigs, and rabbits shall not require rabies post-exposure prophylaxis. So bahalag kahit na nakagat ka ng rabbit po, is you don't need to have rabies vaccination po.
Okay. Pwede bang paliguan ng rabbit?
The best person to answer that is the veterinary doctor.
Okay, thank you po. Thank you.
Is there any other questions from the participants? Doc, there is a question in the YouTube live.
Yes.
Is the dog owner obliged to pay the vaccine of the victim until the whole duration?
I'm not well versed with the ordinance, but based on a clinical experience, most of the time, the dog owner is the one paying for the vaccines and the rabies immunoglobulin. So I think it is, because it's true to my patients. The dog owners are the one paying.
Thank you po. So I guess there will be no other questions, and your lecture is well understand. I now present the certificate of recognition. So still for sign pa ni siya, Doc.
Yes.
So ako na lang basahon sa imuha. Okay, certificate of recognition is hereby awarded to Prismar El Mocoro MD MPM DFM for imparting his valuable insights and knowledge as resource speaker during the webinar on anti-rabies awareness and advocacy for school nurses and school anti-rabies focal persons of Department of Education, Division of Lanao del Norte on June 2, 2021, given this second day of June 2021. Thank you so much, Doc.
Thank you, thank you. Thank you, everyone. Thank you for
Thank you,
listening.
Doc.
Thank you very much.
Thank you.
Thank you, everyone.
Let's proceed for the next to the next speaker, Dr. Fritzy P. Provido, the our provincial veterinarian here in Lanao del Norte. Dr. Fritzy Paler Provido, 40 years old, lives in Southern Lanao del Norte, a mom of three, married to Dr. Hector E. Provido, Jr., graduated Doctor of Veterinary Medicine at Central Mindanao University, Muswan, Bukidnon. Postgraduate study Master of Science in Animal Science at NWSU LNAC. Was employed as swine farm veterinarian for 2 years, then shifted to government service upon employment at provincial government of Lanao del Norte since April 2009. Currently is the acting provincial veterinarian assigned in the Provincial Veterinary Office, PVO. May I now present Dr. Provido. Doc, good morning.
Good morning. Okay ra kung audio? Klaro ra?
Okay na, Doc.
So, mayong buntag sa tanan. Salamat kayo sa pag-introduce na sa ako. Allow me to speak in our native dialect. So, I am connected na sa Office of the Provincial Veterinarian under sa umbrella sa ato ang Provincial Government of Lanao del Norte under the leadership of Governor Imelda Anguin, Quibranza de Maporo. So, I am assigned as the acting provincial veterinarian. So daghang salamat kay no sa ato ang sa invitation for this rabies awareness program webinar. So first of all, I would like to present to you a video of human rabies. Nadiri ang file. Okay. So this is a case of human rabies. 5-year-old boy was bitten by dog. So makita nato no na grabe gid ang salivation. Kindly look away lang no if ever sensitive ta sa mga inani. Pakita lang gyud nato no para ma-realize nato og ma-grasp nato ang importance sa pagpabakuna as soon as possible kung mapaakan ta og dog or cat or any animal for that matter. So another video pero dili na lang siguro nato ni ipakita no. Bata gihapon no. So usually ang victim is mga bata, and kung makita ninyo no, ginahikot sila, gina-restrain bali kay wala naman jud no mawala gyud sa saktong panghuna-huna, and they can self-mutilate. So para ma-prevent nga mapasakitan nila ilang self, ginaana gyud sila. So parehas sa gi-explain kaganina ni Dr. Mokoro no, every 10 minutes someone dies from rabies, and mostly it is in developing countries like Southeast Asia, and mostly more than 95% of the human rabies cases are due to bites of infected dogs. Though it is 100% fatal, but 100% preventable through ASAP jud na vaccination. This is in the Philippines. We have 25 rabies-free zones since 2008 to 2014. This is not yet updated, but this presentation is from the Department of Agriculture. As you can see, only one island that belong to Region 10 is declared as rabies-free zone, which is Camiguin, and the rest dili na sa Region 10. So again, rabies no, just like human rabies, rabies in animals also can be transmitted in through infected saliva. Dili siya ma-transmit through urine, blood, and feces, but also only in saliva of infected animals. Okay. So again, ang incubation period no mao nang katong gikan ta nga time na paakan hangtod sa time nga nigawas ang symptoms. Just like sa tao, inana gyapon sa animal rabies. First na-encounter niya ang irong buang or napaakan siya infected nga animal, show ang signs ana niya kung infected man galing to, naa sa mga 14 days no. Okay. So here it is. Unsa man ang mga symptoms sa animal rabies? Pinakaklaro jud kaayo no in dogs, dropping of jaw. Magbitay lang gid na iyahang baba, dayon ang pati wala siya control siyang tongue. And dry, drooping tongue. Dili permanente nga salivation. No? So dili permanente nga daghan ang laway. Nay usahay dry pa na siya, dili pa kay daghan ang production sa laway. Until then nga di na completely wa na gid siya control sa iyahang diri sa iyang throat, sige na gina produce og laway, and diha ta careful sa laway kay naa diha ang virus. So any two kaning list sa 1 to 17 na signs na diha makakuan ta nga posible rabies. Na ako ipakita later na video kung unsa gi itsura sa dogs no nga kanang infected with rabies. Okay. I would like to ask the help of our IT expert.
Wala audio yung video. Bali kasi ko na. Pero ko na mo pa ng video.
Oo, sige.
Ipa.
Okay ra ta na USB? Or kan?
Ito lang si squad.
Pagabot sa dito tadi.
Wala di. Ha? Ani. Sabihin. Patungo sa tinawag ki asong nani.
The dog has often been described as man's best friend, but this animal's close association with humans is the main reason for it being the most important vector in human rabies. Worldwide, more than 95% of all human rabies cases are caused by dog bites. What does rabies look like in dogs and other mammals? Some of the most characteristic symptoms are the following. Many dogs develop a characteristic continuous howl that is neither barking nor baying. This often progresses to a hoarse, croup-like yowl and unprovoked aggression typify the rabid dog. If the dog is restrained, it might attack the fences or iron bars. If at large, it may roam aimlessly, fighting and biting anything it makes contact with. Movement and sound often elicit aggressive responses. Bone in the throat symptom is potentially extremely dangerous to pet owners and veterinarians because there's a temptation to dislodge the apparent obstruction. Direct saliva contact with open wounds is a potential source of transmission. The frequently reported paralysis of the tongue and dropped jaw signs are pivotal to the animal's inability to swallow. Dogs are often very thirsty, but are unable to drink. Some animals, however, are able to drink and eat even in an advanced stage of the disease. Notice in this case the dog's response to flying insects. Choking sounds and a hoarse cough are often followed by vomiting. Restlessness is consistently reported in all species and may be noted as aimless wandering and circling, pawing, scratching, digging, rubbing, licking, chewing, and depilation. Dogs are excited, agitated, they circle, paddle, lie down, and stand up at frequent intervals. Fly snapping at real or imaginary insects is often recorded. Experienced field workers are often alerted by a weird, fixed glare. As the disease progresses, incoordination is nearly always seen. This may be followed in some animals by paresis, paralysis, coma, and death.
Hello? So, thank you. So, okay. So kani tanan na mga mga symptoms nakita nato dito sa video. So I have to present it kay para mas internalize nato kung sa angay nato bantayan in our dogs, and most especially mga stray dogs mga naalang sa atong mga kalye, matagbuan nato maglakaw ta. Naapoy uban na mga cases na inato ang symptoms but lahi siya ang hinungdanon, lahi ang mga cases na mga diseases of dogs na mag-exhibit, mag-show og signs nga pareho sa rabies, just like distemper and all other diseases in animals na ay encephalitis or maka-infect sa brain, makahubag sa brain. So naa siya inato po nga mga sintomas. For Lanao del Norte rabies incidence sa 2014 dinhi sa mapa, makita nato ang star. Mao na siya mga human rabies death, Sultan Aga de Maporo, sapat, 3 sa lala, and Munay. And makita nato nga Sultan Aga de Maporo and especially Munay mostly inhabited by our Muslim brothers and sisters, but still na ay rabies nga dili man gid unta haraman ang magpagbuhi og iro, but naagid ang rabies tungod kay kani siya nga istoryahon is tungod sa mga stray dogs, stray dogs niya. Maglisod tag bakuna ng stray dogs, dili na to magunitan. And aha man gikan ng stray dogs. Kasagara gyud gikan ra pud siya sa mga dogs na wala na naalagaan sa tag-iya, nanubra, wala nato na napasagda nato, sige silang panganak hantod managhan kayo, di na nato kaya alagaan, o maato na sila dito sa wild, dito sa magpalagdas na lang sila, and makakos sila o makakos sila og distraction sa palibot kay kanang inana, bisan asa, bisan basura, panggugon. So daghan kaayo makakos, usa sa mga causes sa vehicular accident is kaning mga stray dogs. 2015 kaning square mo ni ang human rabies death. Kulambugan, Tubod, Baroy, and SND. Animal rabies, isa lang. Kani makaingon ta isa ra ang animal rabies, but wala ni siya nag-reflect sa tibuok nga status sa ato ang probinsya sa animal rabies tungod kay mabaw-an lang nato ang ma-confirm lang nato ang animal rabies through sa examination of dog's head dito sa Regional Animal Disease Diagnostic Laboratory sa Cagayan de Oro sa Department of Agriculture. Whenever na ay mga cases na nakapaak ang iro, no? Ang uban mo sultigid sila no, mo coordinate sila sa municipal agriculture offices, and ang municipal agriculture office mo coordinate pud sa MOA. So kami ang mo padala ana sa sample no sa dog's head dito sa Cagayan de Oro and free of charge. 2016 na gihapon no, nagbalik-balik lang ato ang mga probinsya, ato ang mga munisipyo no nga naa ang rabies both sa human and animal case. 2017, the same, kapatagan, lala, kauswagan, animal rabies. Thankfully, isa ra ang casualty no, sa tubod. Dito ni dapit sa Aloha. 2018, naagihapoy human rabies death, nga which is dapat wala gid unta. But during sa among mga interviews, ang gakahitabo, kabalo sila nga naay bakuna, but mahalan kuno sila sa bakuna. And usahay man gud mahutdan gyud pud no. Mahutdan og bakuna ang para sa tao. Para sa tao mahutdan og bakuna sa nang makagasto, but dili gid na siya dapat mahimong rason nga dili maadto og hospital no. Kaya mapangitaag paagi ang pagpalit sa bakuna. Pero ang kaning kung nag-exhibit na og sign, ibalik na ko ang istorya kaganina ni Dr. Mokoro, once the signs are there, mahadlok na og tubig, mahadlok na og hangin, di nakatulon, bisan pagpila ka milyon atong kwarta ana, wala na gid na siya. Sa animal rabies prevention ani dili gyud hassle. Why? Once a year lang siya nato bakunahan and libre no, gahatag ang Department of Agriculture sa bakuna, and also provincial government ga-procure gyud no through sa under sa leadership ni Gov Angging, ga-procure gyud ta og animal rabies vaccines. So gaadtuan pa gyud by barangay, and naapud tay mga libre nga mga kapon and ligate no sa iro. So pwede ra gyud na mo coordinate sa mga sa provincial veterinary office about that, and also sa respective municipal agriculture offices. Libre ang bakuna, dili hassle, once a year ra. Mintras buhi ang ato ang animals, ato ang pets, once a year gina siya no, mga booster shots. So next slide. Sorry, balik. 2015 mo ni siya ang rabies vaccination coverage, meaning kung pila ka ang population sa estimated population of dog, mao na siya ka porsyento ang ato ang mabakunahan. Pinakaubos, estimated sa tibok probinsya 23,000, vaccinated only 2,700, so 11.3%. 2016, taas na 47%. And makita nato diha nga nagi mga munisipyo na wala gid ta nakabakuna og rabies no. 2017 and 2018 vaccination coverage itaas-taas ta sa 2018 na 61.4%, and ang pinaka sakto gid ani no nga makaingon ta nga na ay herd immunity is dapat 70% up of our dog population must be vaccinated against rabies. So napoy mga positive cases sa 17 and 18. Nakita nato din hino. Patagan, kauswagan, kulambugan din namon tubod. So summary, mao ni siya. Animal and human rabies. For 2019, naagyoy 4 ka buok no. Human rabies death. Kapatagan 3, lala 1. And ang istorya pa jud ani is naa siya kwarta for vaccination but wala niya gamit para magpabakuna kay gipalit og motor. Ano niya nagamit ang motor niya tag hospital, nag-show na og symptoms, hilanat, kurog-kurog. And in 3 days time, ipahuway. Sayang. So, mo ni siya no, mga barangay nga na human rabies death. Plan of action for rabies-free Lanao del Norte. Makita nato nga 2020 kay ang national na target is rabies-free Philippines by 2020. Pag-abot sa 2020 last year, nakita nga wala gid siya na zero incidents. So, gimove to 2030. So, naapatay 10 years or 9 years na nabilin to achieve this. And niabot po ang ato ang problema karon nga ang pandemic, so medyo nadugangan ang ato ang mga limitations na. So usa ta ani dinhi karon awareness and education campaign. Sa gipakita kaganina sa first presenter nato no, naagyod sa ato ang Republic Act 9482 na naagit ta magtinabangay ta sa awareness and education campaign. And it is my hope no na sa atong mga pagpaningkamot na maayon ta gyud nga masulod nato sa ato ang curriculum no, kay sulod naman gyud siya sa curriculum, matudloan gyud nato from kinder up to college. So naa diri sa population control, spay and neuter, no? Spay and castration. Spay ang tawag ana kung babae, no? So ang pinakabata nga pwede nato spay nga dogs and cats is 7 to 8 months. Ang pinakabata pod na pwede nato ikapon sa dogs and cats is mga 1 to 2 months, as long as naana ang no, nanang testicle na ang itlog, kita na. Libre na siya, coordinate lang ta sa Municipal Agriculture Office or directly sa amo ang opisina. Naami sa agriculture compound sa Crossing Kakay, nasa highway, sa Pigkarangan. So, morning, ang RA 9482, and implementing rules and regulations. Batas patungkol sa pag-aalaga ng hayop ayon sa batas na Republic Act 9482. So, iparehistro no, pabakunahan laban sa rabies ang alagang aso. And paobserbahan ng iyong alagang aso kapag ito ay nakakagat. So, 14 days ang atong observation period. Sagutin ang gastusin sa pagpapagamot ng nakagat ng iyong aso at lagyan ng tali ang alagang aso, no? So naagid na din na if ever i-walk nato ang ato ang dogs and cats, dog ato agid siyang talian, no? Dapat naka-leash. Walay dapat nagala-gala lang nga iro sa ato ang palibot. Kung currently natin daghang makita, no? And it is the responsibility of the local government units, no? Na naitay dog population control. Gikan sa sinugdanan sa barangay until pataas ato sa probinsya. Trainings na natay gipangkondak ana sa ato ang munisipyo, no? Mga gamit na natay nahatag ana, no? Ato lang nga ang pag-implement, no? Magtinabangay ta sa implementation sa labi na gyud sa ato ang dog population control. Dili magsunod na dinhi ang multa nga makita nato. So unsa man gyud ang importansya why we should give anti-rabies vaccine to our pets. So, bantayan na to, no, 3 to 4 days before pa nakita na tong simptomas sa iro, pwede na siya nag-shed, no, nagpagawas na siya og virus. So, dili ta magsalik if ever we are bitten by a dog or cat. Tapos, tanaw na to, okay raman, wala man siya naunsa. Dili lang ko maadto. Aya na ta maadto kung nagdaot na dili na siya, sayop na siya nga panghunahuna, no, nga perception. Tungod kay 3 to 4 days before sa onset sa clinical symptoms sa biting animal na pwede na din na siya diha mag-shed og virus. So as soon as possible na pwede ta nga napaakan ta, as soon as possible mag-seek din ta og medical help. So annual shots of rabies gyud, no, para sa ato ang mga dogs and cats. dili lang pud rabies ra ang gikinahanglan lang nga bakuna, daghan pang klase, so makikoordinate ta sa ato ang mga local veterinarians and follow leashing policy. Dili lang ni siya provincial ordinance sa ato rabies program, but naapod na siya sa municipal and some barangays na nag-adapt na ani nga ordinance. Regular grooming, adequate food, and clean shelter. Nganong naaman unsay connection na niya sa rabies, or dapat naagin ni siya kailangan maayo ang atong responsible maayo atong pag-alaga nila tungod kay if they are healthy, expectedly maayo ang ilang immune response, dili sila dali magdaot kay wala gyud 100% na absolute jud nga protection against rabies, though you know nga complete ang vaccination sa imong dog, but tungod kay bisita di kay nato maalagaan, so medyo gihapon nga pwede gihapon sila magdaot, no? Pinaagi ana ma-weak ang ilang immune system, posible dahil gihapon nga magsakit sila. So dili lang ni siya naka-implicate sa Republic Act 9482, naapod ni siya sa Animal Welfare Act. Kung dili lang gyud ta mabaakan og dog, no, dili man gyud ta siguro magka-rabies. Gawas kung natalsikan ta sa laway sa rabid dog, naabot sa tong mata or any mucous membranes, no, posible na siya mosulod dito, or kung natay cut sa ato ang skin. But ang pinaka dako jud siyang transmission route is ang dog bite. So kung para malikayan ni siya, no, dili ta mo approach og unfamiliar dog, especially those who are tied or confined behind the fence or in a car. Usahay magsulod ta sa usa ka balay, na sila'y kural, kana siya ang behavior sa dog or ang psychology sa dog is territorial na sila. So once na ay stranger mo sulod dira sa ilahang personal space, mahimo na silang defensive. So nya ang uban wala nahiktan, kalitan kag dasmag paakan ka, may lang og kay nakaila ka sa tag-iya, pwede nimo pangayuan og tabang for your medical expenses. But how about kung dito sa stray dogs, no, so mahimo na ay stray dog diha sa ato ang nasugatan nato, likay na lang ta. Dili na to disturbohon ang nagkaon na dog. Makita ninyo diya, binuang na siya nga graphics, no? Kanimo gud siya nga presentation, ginagamit nako ni sa during IEC in the schools, no, sa mga bata. So mga tawa man gud ma-alert sila nga nagkutsara ko na ang dog may paang iro kay nagkutsara. So dili sila hilabtan kung nagkaon. If ever gusto ka magpakaon ka sa imong dog, no, dahil gusto nimo dugangan, mag-wait ka na mahurot ang food nga naa atong sa iyahang bowl, no, sa iyang bowl dayon. Pag mahurot na, taas na siya sa iyang naong, tanaw siya nimo, pwede na nimo to gunitan ang bowl, dugangan nimo, ayhan nimo balik sa. Pero ayaw pagkuha nga nagkaon pa siya kay kasagara masuko sila, no. Dili ta gusto ana. Pero usahay mo na gitawag na nga provoked bite, no. Na provoke, dili kayo na siya hadlok, no, kanang bitang napasakitan, muna nakapaak siya. Pero ang hadlok ayo nga paak is kaning unprovoked. Kanang sagwan nimo hilabti, nilabay lang kasi ang daplin, kalit check paak nimo, ay kumpiyansa na, no. Then don't surprise a sleeping dog. Natulog siya, ay sikalit kag ingog chi og napapaakan ka niya. Namirisita. Sorry. Avoid dog bites, no. So dili kita mag-assume nga ay ka-cute kayo ang nagdala sa iro. Choy kayo. Ay ka-cute do nga pakan na ka. Tingog pack. Okay. So don't play or come near a dog with a litter of puppies, no. Kung naay gipang patutoy, no, kasagara ka ng mga lactating dam or lactating mothers, lactating dogs, kaya na sila ilang mother instinct, no, grabe gyud. So ayaw pag hilabti lang puppies, lami samot na kung dili ka ang tag-iya. Don't pet your dog or nga mo ritual lang ka og duol or even sa katong seemingly tamed dog, ayaw pag-reach og duol. So ang buhaton nimo, ipasimhot sa nimo ni imong kamot. Make sure lang nga nang hunaw ka kay dili na nimang sudan imong kamot. Ipasimhot nimo iyang kamot nimo sa iya ha, then isimhot ayan na din kamo palit na. no? Even kami magbakuna mi, mag-treat mi ay pasimhot sa daan. Pag magwagal yang tail, butan. So, panalitan jud naa nagiiro nasugatan nimo no sa kuan dalan. Stig yung stricto gyud kayo perting isuga no. Don't run. Nga nagtaatubang siya nagpaghot nimo. Ay pagdagan talikod di dagan kay ngano ang psychology pud ana sa dog psychology is ang pagpakita nimo og dagan talikod sa iyaha while siya perting isuga na kuan ka nahadlok ka. So ang ihapon tendency na siya po mo paak nimo kay nahadlok siya nako ako siyang paako ni nana ang ilaha. So kung nahadlok ka mo yuko lang ka siya tanawa ayo pag ay tuay yuko lang ka na pundo nakabantay ka mag-away ang iro dayon mag-ana na gani ng mahadlok ayo ang kanang giaway nila labi nag-pack of dogs na sila isa kontra kabantay ka nga ang katong tan-aw nga nimo nga ang iro nga ilang giaway dili gid siya molihok mo pundo ra mag-ana ra so inana ang mong buhaton dili na nila dayon nun og attack kung dili mo dagan dili mo lihok dili gid na nila dayon no sinana pud ta no become an assertive no kung kinsa tong nakailan ni Cesar Millan sa National Geographic a dog whisperer daghan kitag makatunan dito no become an assertive bahalag nagkurog-kurog na natong tuhod sa kahadlok no but pundo lang gid ta look down no ayo tanawa ang dog but in kaso no mo ni siya niya ayo gid dagan pagtalikod nimo na absan jud no. So, in kaso kung isog yun ang iro, then gi-approach na yun kanya, doon na yun sa imo ha. So, ang imong buhaton, mangita ka o anything, palitan, nagdala kag umbrella or bag, mao to imuhang iput in between sa imuhang body o sa dog. No? Para dili directly ka mapaakan. Then, hopefully, naara po'y makatabang nimo. Labi na gyud o rabid dog or irong buang. Basta yung hadlo ka, nakatry na gyud ko no? Remain motionless with hands on your sides and avoid eye contact. Pundo lang yun ka. So kung nipalayo na siya nimo, no? Once the dog loses interest in you, slowly back away until he is out of sight, no? So hinahinay na din kag atras nga ayo talikod, atras nga nagatubang ra gyapon ka sa dog, hinahinay og atras. Then pag wala na gid siya ni talikod na siya nimo, that's the time na ikaw mo talikod na pud kaniya. Pag nag-atubang pa siya nimo, ayaw gyud pagtalikod niya. Atubang na gyud ka, pero ayaw siya ito eye contact. Mura na siya og tawo nga masukog tan-awon kay mura pag nakaminos niya no. Ayaw siya tan-awa sa mata. Imo lang siyang side eye lang, hinahinay kag atras. Hanto jud siya nga mapalayo na kaniya. That's the time og layo na gyud ka kaya niya dagan. Pwede ka maabsan. Okay. So mo ni siya no, feed him your jacket, purse, bicycle or anything that can put between yourself and the dog. And if you fall down, banalitan, napaaka na gyud kaniya, no? Mo kuan na gyud ka, girl like a ball. So, imong protektahan imong naong, imong neck, no? Kay naa dira ang mga kuan, no? Kusog kay mag-bleed, no? And ma-prevent yun nga ang ulod nga side o ang diri nga side na malikayan. Kay labi na ginailahan diri ra ba ginakasagara ilang targeted sa diri mga cephalic nga side. Ay kaning neck nga side ayan delikado ka og bleeding and ang bite dool sa brain mas shorter ang incubation period no. So once again no balik ko na to kung napaakan ta og dog or cat or any animal no running water with soap for 15 minutes dayon adto ta sa nearest animal bite treatment centers asa dapita ang atong pinaka duol kayo center is ang Baroy, Kapatagan and Kauswagan and before pandemic naa ang Kulambugan Provincial Hospital but karon kay gi-convert siya into isolation facility so sa Kauswagan na. Balik na ko din observe na to ang biting dog. Kung available ang biting dog, i-observe siya for 14 days. Padayon siya nga pakanon, dili siya tagaan og bakuna, walay buhaton ana. Siya mismo ang biting dog, ang buhaton ra ikulong or padayon nga ilish, then observe for 14 days. If ever within that observation period nga 14 days, mamatay ang iro or magdaot, mag-coordinate lang sa agriculture office or directly sa amo sa provincial veterinary office kay if ever mosugot ang tag-iya sa dog, amo ang putlon ang ulo, then ipadala sa Regional Animal Disease Diagnostic Laboratory in Cagayan de Oro, free of charge. Dayon within 1 to 2 days, mabawan na dayon na siya kung positive ba or negative sa rabies, no? Ang biting dog. If ever positive, mo-coordinate gyud ta balik sa doctor, no, sa ato ang physician. And naaman pud na ang official nga laboratory result amo po nang ipadala sa kung aha dapita nagpabakuna ang bite victims. So, ito siya. So, nabalik na niya siya, no? Senyalis kung na-rabies. So, that's all. Thank you.
Okay na, Doc?
Okay, that was Dr. Christy Rubido, and we would like to thank her for the inputs. That was very valuable and that could guide us as we go hand in hand in raising awareness and advocacy against rabies. So, at this juncture, we would like to entertain if there are any questions, clarifications regarding the topics that were discussed. So this is the time now that we're going to. You can raise your hand or maybe chat in the box if you have questions for our resource speaker to answer. So since there are none, let us proceed to the formulation, the making of the action plan. Oh yeah. So before we proceed to the making of the action plan, let us first award the certificate of recognition. So let me read to you the content of the certificate. Certificate of recognition is hereby awarded to Fritzi Paler Provido, DVM, Doctor of Veterinary Medicine, for imparting her valuable insights and knowledge as resource speaker during the webinar on anti-rabies awareness and advocacy for school nurses and school anti-rabies focal person of the Department of Education from the Division of Lanao del Norte in June 2, 2021. Given this second day of June 2021, and to be signed by Dr. Sir Edelberto Elo Plenaria, Schools Division Superintendent. So now let us give time to the formulation of our action plan. I-flash daw palihog. Kaning ma-flash nyo? Ma-discuss na sa kadyo. Okay, so makita na dito naman. Okay, in your screen you will see you'll find the format of the action plan. So this is an action plan on anti-rabies awareness and advocacy for this year 2021. So basically we're going to okay, again, class before you is the format of the action plan on anti-rabies awareness and advocacy. So you will find there the name of the school and to which district it belongs. So it means that each of the school, together with the school nurses, district nurses, and the school anti-rabies focal person, you are to formulate your action plan for the activities that you are going to undertake in order to raise awareness against rabies, and advocate. So there you will find in the first column, you have the objectives and the activities. So previously, it was flashed or it was discussed by Dr. Rubido regarding the various activities that you may undertake. So at least that would give you an idea on which activities you will adapt for your own setting. So the persons involved, like I said, that would involve the focal person for the anti-rabies for each school, together with the district nurses. So this will be a collaborative effort between the two of you, and the district nurses also will be the one to collect the outputs of this action planning. So I have asked our focal person regarding the deadline or the submission for this action plan, and she agreed that tomorrow uh, a soft copy. You are going to send a soft copy. Yes, school focal person will send a soft copy to your district nurses, and the district nurses will be the one to forward that to the focal person in the division office, the program holder, none other than Mujer Guapa. So the time frame to complete the action plan, it is very important that we have a target date for the implementation of the program and of the outcome that we are expecting. Basically, those are the parts of our action plan, and I hope you are already enlightened with the discussion of Dr. Provido. So I would presume that it would be an easy thing for you to do. So since you have to submit this tomorrow, so you still have ample time to complete the action plan. Okay? So now the program. Okay. To formally close our affair this morning, let us give time to the uh, officer in charge, the OIC of the school health section of the Department of Education of Division of Lanao del Norte, Dr. Melvin C. Inerio. Doc, it's your time to shine, Doc.
remarks. Okay, call on Dr. Melvin for the closing remarks of the program.
Okay, good morning once again. In behalf of the School Health Section of the Division of Lanao del Norte, we'd like to thank everyone for participating in this rabies awareness webinar. We are so grateful and thankful for our speakers for the webinar, Dr. Maporo and Dr. Provido, for imparting their knowledge and sharing their precious time just to be with us. And we would like to thank also the support of our Schools Division Superintendent, Sir Edalberto L. Plenaria, our ESDS, Ma'am Rosemary Macesar, our two chiefs, especially the supportive and motherly chief of the School Governance and Operations Division, Chief Maricar Abilin, and also to mention the program coordinator of this program, Ma'am Patri Dumato, for the hard work and in preparing this webinar today. I hope that all the learnings and all the knowledge that we have learned today will be cascaded to our respective districts and even to our families, to our neighborhood, so that everyone will be safe from the harmful effects of rabies. And I hope that we will also become a good and responsible pet owners. So once again, good morning and God bless everyone.